I am live for the second time today, and I was just sharing a tweet, or Georgia was sharing a tweet. Georgia Davenport, who is the field director for Whole Washington for Universal Health Care, and she shared, so I haven't even read it yet, but she just shared an article that she's recently published. I told quite a few people that I was going live here to read the article. I see somebody has joined us, so I'm going to just give like a couple of minutes, talk about some other things while I wait for just another maybe potential couple of people to join us in case they wanted to. I don't know if I drop a comment if you want, to see if I can see your comment. And if not, that way I'll know if I've got some settings that people like can't even comment. Although now the person that was watching is no longer watching, so maybe that wasn't somebody who was intentionally going to join us for this. So it's okay if I get going with this. So much of the exciting news today, as I shared in the earlier live stream, was regarding, I liked how this was like sitting on my head earlier today a little better, was Dr. Dooley's tweet in support of the Red Berets with the Whole Washington button. And she has since, commented and retweeted several other things. So that's just so amazing. Thank you, Dr. Dooley. So I hope I don't kind of like mess this up as I'm reading. I will post and share this out in a tweet. I shared it one place because I dropped that I was going live on a couple of different threads that I'm on Twitter. And I hope I don't kind of stumble over the words here because I haven't read this yet. But I'm up in my up in an upstairs room. So, okay, here we go. I'll start reading. So we've got the title of this article is, just put this in the middle here, is Despite High Expectations, Washington's Universal Healthcare Work Group Falls Short. And just again, for the introduction, I think everybody who is following and participating and helping the Red Berets definitely knows who Georgia Davenport is, but she is the founder and field director of Whole Washington for Universal Healthcare, which is it's an organization that works to organize locally for universal health care for Washington State, but they also do a lot of work with one-payer states to connect with other one-payer states and help build solidarity and strategy for getting to all of our common goal, which is national improved Medicare for all. And then the kind of third prong of their approach. So we've got one-payer states, and we do a lot of national organizing as well. So a lot of support for the federal bills and organizing around that. Like we've organized barnstorms alongside with National Nurses United when they've done that in support of Representative Pramila Jayapal's bill. So that's Georgia Davenport, and she's written this article that's called Despite High Expectations, Washington's Universal Healthcare Work Group Falls Short. And I will tweet this out if you're following me on Twitter so that you can share it. Because we have to write our own media because the corporate media doesn't want to cover anything to do with universal healthcare, right? So, all right. After much noise, some cautious optimism from healthcare organizations, and nearly 2 years of work, the Universal Healthcare Work Group, UHCG, fell well short of the goal many of us hoped for, a recommendation to the legislature of a state-based single-payer system. So why, after all the fuss, a $500,000 price tag to the taxpayer, public input from hundreds of Washingtonians advocating for a publicly funded system, option A, as named by the UHCG, and the clear demonstration of the UHCG's report that option A would save the most money while covering the most people, 1. Did the group not recommend option A? Well, as usual, it comes down to who was at the table. From the moment the group was announced and the stakeholders were listed on the Healthcare Authority, HCA, Site 2, I was suspicious the effort would result in anything more than a recommendation of bolstering Cascade Care. Cascade Care is Governor Inslee's so-called public option. So should I pause and take a breath? I do like to read alive. I like to read aloud and live. So, and this is really important, that we share the article. You can also help us by continuing to ask Representative Pramila Jayapal to endorse Whole Washington. That would be an absolutely enormous endorsement. Sorry, I like to, my mind gets thinking, I want to read this seamless article, but I'm already coming up with commentary and thoughts that come to my mind about it, because we're going to have a huge battle on our hands of getting what Georgia's going into. They're pressing for Cascade Care, and I'll get into what that is, but we need a lot of people to understand that that's the that's the messed up place that a lot of moneyed interests and Democrats and Republicans who take corporate cash are going to be trying to steer us in that direction. So having endorsements to share out that when people hear about Cascade Care, that's not where we want to go. So I will continue reading. My grandmother crocheted this. This is kind of like Funky's 70s colors, isn't it? And scratchy red heart yarn. That's okay. I love it. Okay, so we have... So I was suspicious the effort would result in anything more than a recommendation of bolstering Cascade Care. Cascade Care is Governor Inslee's so-called public option bill that I have written about previously. Despite it being called a public option, it is not a public option, as it is available only to people who buy insurance coverage through the exchange, which is less than 3% of the residents of the state. Further, it has the HCA contracting with those insurance companies, which is the opposite direction we need to go to guarantee that everyone has affordable health care coverage. Additionally, a public option is supposed to be a state-run insurance option that is available to everyone, which competes with private insurance companies. The goal of the public option is to offer more affordable coverage that will eventually eliminate the need for insurance companies altogether. I felt fairly certain that since some of the stakeholders would find a real public option untenable, that they would push for the faux option as exemplified by Cascade Care. This is one instance where I hate to be right. It appears that option C, a Band-Aid solution like Cascade Care, is being framed by leaders in the legislature as the pathway to universal health care. Unfortunately, this patchwork system will still leave many hundreds of thousands of Washingtonians uninsured or underinsured. And we have the wonderful graphic that I have saved. And again, if you go to wholewashington.org and sign up to be a volunteer, it doesn't matter, and sign up to, receive the email updates, or just look on the website. I'm pretty sure under tools and whatnot, you'll be able to find this graphic, which is really useful to just share around on social media, because it has Whole Washington Health Trust. Our bill is SB 5204 in column A, which says people, and then Cascade Care, profit. So under people and Whole Washington Trust, it's got green checks for nonprofit, publicly financed healthcare, available to all Washingtonians or Washington state residents, no deductibles or out-of-network fees, collective bargaining power for prescription drugs, includes vision, dental, mental health services, and more. And then under the Cascade Care and Profit, it's got X's on all of those points that I just made. So not good. It's a very simple and effective graphic. So I like to share it regularly. Continuing, Georgia Davenport's article. Due to the fact that some of the stakeholders of the group are affiliated with the very companies that would have their bottom lines adversely affected by a real public option or nonprofit publicly funded system, the outlook for those systems being recommended at the end of the UHCG was slim to none from my perspective. Despite this, I attended a few meetings, gave public testimony, and encouraged dozens of others to do as well. One cannot say that the organization I volunteer for, Whole Washington, didn't do its very best to influence the outcome in the other direction, away from our tax dollars being siphoned into the pockets of insurance CEOs who make millions even while people are denied treatment and rationing insulin. Yet, clearly, our voices are not as loud as the voices of the insurance lobbyists. It didn't make any difference the amount of public testimony or even the overwhelming proof by their own study that a publicly funded and administered system would be better. The outcome of this study group was predetermined due to the sinister motives of some stakeholders to ensure that no real reform ever happens. I do not wish to belabor this point, nor focus on the wasted time and money of the UHCG. It is another example of insurance companies getting a seat at the table by feigning good faith. Wendell Potter, who was the head of PR at Cigna, wrote about a similar situation in his book Deadly Spin. Insurance lobbyists like Karen, I'm going to say her name wrong probably, Karen Ignangi, convinced President Obama that she and other lobbyists should have a seat at the table and would help the president by taking healthcare reform efforts seriously. Mr. Potter writes that at that moment, quote, the president, having just been played like a Stradivarius by one of the best lobbyists to hit Washington, said, good, quote, thank you, Karen, that's good news, end quote. Similarly to President Obama, our legislators and well-meaning healthcare organizations here in Washington were played. Mr. Potter goes on to say at the end of his book that, quote, the cliche that if it sounds too good to be true, it probably is generally true. The oil company that wants to reduce dependence on oil, the health insurance company that wants to make you well, the tobacco company that wants to discourage smoking, the finance company that wants to help you make money. Count on it. Any for-profit company that claims to have no self-interest has nothing but, end quote. Now, I wouldn't be an organizer if I ended this article without a solution, and the good news is that there is one. The Whole Washington Health Trust, SB 5204, was introduced this session by Senator Bob Hasagawa and 6 co-sponsors. It is an Option A solution to our present and ongoing healthcare crisis. This legislation would create the first ever universal healthcare system in the United States, covering vision, dental, and prescriptions as well. We could say goodbye to deductibles and surprise billing. Lose your job due to unforeseen circumstances like COVID-19? No problem, you're still covered, and you won't be paying COBRA rates for the coverage either. So if you believe we need to join the rest of the developed world, saving lives and money, contact your representatives about the bill by calling 1-800-562-6000 and ask to leave a message. Or you can use the form on the Washington Ledge website here, and she provides the link. But again, I will, and that's too long of a link for me to just read off, but hopefully you're following me on Twitter, and soon I'll learn how to put links in for the live stream. But anyway, the time for transformational change is now, but it depends on people like you and me. Again, just to go back to the link, the important thing is that everybody in Washington State and people who know people in Washington State and people just who want to connect all of our efforts up for state-based and national efforts, you should please go to wholewashington.org and sign up to be a volunteer. That doesn't mean that you're going to be expected to put in hours every single week. Maybe all you'll do is receive the email updates. Maybe you'll make an occasional donation, but that isn't going to be a necessity. Maybe you will share on social media. Maybe you'll get an update about attending our monthly book club, and then you would get to come to the free event that we held where we hosted Wendell Potter recently. So we will have more amazing authors coming up. So that is an advantage to everyone, no matter what state that you live in, to sign up for wholewashington.org. Thank you. So back to this article. Georgia, this is the end. It's just saying Georgia Davenport is the field director for Whole Washington and One Payer States. She is also the Stevens County, Washington State Democratic Committee member. She writes this article in her capacity as a healthcare advocate, not as a representative of those organizations. So we have sources that she has cited here in this article. And it is on Medium. It's gdavenport.medium.com. So if you would like to go and and let's see if I can do that right here. Yeah, and Jen Nye has already done that here. So Jen Nye is amazing. She is oftentimes running the Whole Washington Twitter account. So also, if you are not following Whole Washington at Whole Washington, please do so. They're always lifting different organizations and people who are fighting for national improved Medicare for all, and also amplifying other one-payer states organizations, and then also the voices of the 99% who are, sharing their healthcare stories or people that they come across that they want to amplify. It's a really great account, so I hope you're following them. And that's it. That's just is why I wanted to have the Red Berets YouTube channel, is because I just want to be able to get on here if there's something exciting that I want to share, and the information that I want to get out there. You're going to hear me repeatedly just go on and on and on about please signing up to be a volunteer or receive email updates from Whole Washington. I live in Washington State. I don't know. I mean, obviously, I think many of you who follow me on Twitter know that. Like, if it seems like, oh, I thought Red Berets for Medicare for all would be like fighting for Medicare for all. And this is why I have mailed Red Berets to people. I mailed a couple to Joy Marie Mann, Savage Joy, and Pat the Burner, and Chris Richards, and and obviously Dr. Dooley and Senator Nina Turner. So and among many, many, many more amazing people, just kind of over the course of time. So I've done my utmost with just my knitting fingers to amplify and creatively. And Sema Hernandez, and so lots of people, national movement people. Scott Desnoyers. Scott, I'm so sorry. I feel like I always say your name wrong if you catch this live feed. Danny Strong is his hashtag, and No One Fights Alone. So I've tried to kind of build Red Berets out to be a national creative effort or idea that people can join us on. But you hear so much about Whole Washington because I live in Washington State, and the nurse introduced me and my knitting and my ideas to Whole Washington, and that's how I met so many amazing organizers. So obviously Whole Washington is how I can directly impact healthcare efforts, is by organizing at the state level and helping to get the word out about how they are helping, not only at the state but nationally. So hopefully I just can continue. I'll get my own Zoom account and get going here so that we can have some panelists on, and that's a learning curve for me, so be patient. It's not always just going to be a monologue of me speaking to all of you and just by myself, but I'm just happy to be on YouTube and to kind of overcome my nerves about just something that for some people is super basic. For me, it's a little bit daunting, but this is a good step. So thank you for all joining, and 20 minutes is actually kind of short for me. So thank you. Have a good evening, and it was good to see everybody twice today here. And if you share this video or our YouTube channel, please like and subscribe. It'll take a while to get any kind, and I don't really care, that it's so that when I have something to say, I can just get out there and say it. Twitter is effective. I've learned how to say my message really succinctly, which is good for me. But also there's just some times where I think we need the human connection, and I have more to say than what I can just express on Twitter. So that's why I have this. And thank you all for watching, and hopefully liking and subscribing and sharing. Thank you very much. Have a great evening wherever you are at. Fight for Medicare for all. We are not going to give up until we get this done.